my pleasure, Mark, to introduce Dr. Lina Shihabuddin. She's a behavioral health. Dr. Shihabuddin is the Chief Medical Officer for the Behavioral Health Network at RWJBarnabas Health, as well as the Medical Director for Visiting Nurses. Good morning.
Good morning.
The Visiting Nurse Association of Central New Jersey is what you're also associated with, and you're the board certified in adult and geriatric psychiatry.
Correct.
Is that correct? And as well as hospice and palliative medicine.
That's correct. Yep.
Oh. Well, good morning, and thanks.
Good morning.
For anything else you'd like to add about yourself?
No, I am the Chief Medical Officer for the RWJBarnabas Health, which is a network which extends from all the way from Hudson, Jersey City, down to Toms River. All the RWJBarnabas Health facilities have some sort of behavioral health component in them. We have them in the hospitals, as well as we have them in practices like here at 222 Columbia Turnpike. We're going to have a behavioral health team consisting of a physician, a psych APN, and a psychologist available to take care of patients.
Right, you were telling me earlier that's still in the process of happening, but it's something that's going to be happening real soon.
We have the staff, we have the team, and the start date for them is August 15. As of August 15, we will start seeing patients.
Very good. And of course, the facility is so convenient. It's here on Columbia Turnpike in beautiful Florham Park.
Absolutely.
If you don't know where it is, if you remember where the Boy Scouts of America used to have their headquarters years ago, it's that same wonderful building I used to go by all the time. It's a 12,000 square foot facility, all one floor. They completely redid it, and it looks great. Well, Doctor, thanks so much for talking with us today, but if you could just share with us a little bit, what is behavioral health?
Well, behavioral health was traditionally referred to as psychiatry or mental health.
I see, great.
So people would say, oh, I need to go see a psychiatrist, I need to go see a therapist. That all falls under behavioral health. But as, we're trying to integrate the care of the patient in a wellness perspective, behavioral health is part of their primary care. It's part of the taking care of the whole patient. So it's not, oh, I have to go see a psychiatrist somewhere out there. Now psychiatry is right in where your primary care doc is, where your cardiologist is, where your pulmonologist is. It's an integral part of all the patients. It's an
integral part also of general health.
Yes,
in other words,
absolutely.
your medical health, then you have the psychiatric health, all merged together in this system, all in one place, so that you can integrate the general health of the well-being of a person.
Absolutely. And, there is a very big move now in the country to screen for things like depression, anxiety, adjustment disorders in the primary care setting and help the patient get to the therapist they need, the medications they need, so that they are taking care of all their needs towards wellness, rather than I have a disease and I need to see a doctor. I need to be well. We do prevention. We do depression screening. And, kind of stay ahead of the game instead of reaching a point where you are so ill that, you really need much, much more care.
In an economy, when you're not well, in a family, when you're not well, everything falters. Things fall apart, things get backed up, and therefore when you're able to improve not only the medical, of course, but the psychiatric health and well-being of a person or a community, things improve, life improves. Well, what types of conditions can behavioral health specialists treat, actually?
Well, anything ranging from mild stress, which we're all under.
I have that.
Things like,
Sign me up. No.
College students coping with being away from home,
That's big, yes.
Taking care of, becoming adults and grown-ups, and people having stress on their jobs, people unemployed, not being able to find jobs, people struggling with relationships with their parents, with their children, with their spouses, people going into some sort of a mild depression, people who have genetic tendencies towards depression or anxiety, which manifest a lot of times in medical issues. They come in with palpitations, they come in with chest pain, they come in with stomach pain, and it turns out to be depression or anxiety. So we treat the range from those mild ones all the way to seriously mentally ill patients with psychosis, schizoaffective disorders. We in the system have a big eating disorder program in Somerset, which belongs to RWJBarnabas Health. Mm-hmm. We have an inpatient eating disorder unit. We have an outpatient eating disorder program, which we are definitely looking to grow, because eating disorders are on the, they are becoming much more, people are more aware of them.
Aware, that people were not aware in the past. I have some experience. My wife did work in an eating disorder unit for many years, so I got that years ago.
Right.
So I was told.
So now people are seeking treatment for them.
Absolutely.
Much earlier.
Much earlier, and that means, of course, everything progresses, things get better, and people are happier. Dr. Shihabuddin, anything else you'd like to say?
No, thank you. Thank you for the opportunity. We would like to start seeing patients as of August 15.
August 15, that's the big date. So I would thank you so much for sharing with us, and wonderful to meet you.
Thank you very much.
Have a great day.